To understand how to figure out the action of a new muscle, you first must understand the different muscle movements. First, there is abduction and adduction of limbs. Abduction is when you move away from the midline, and adduction is when you move towards the midline. Lateral rotation of the limbs is when you rotate away from the midline, and medial rotation is when you rotate towards the midline. Flexion of a joint decreases the angle of a joint, and extension of a joint increases the angle of the joint. Flexion of the spine is when you bend forwards and decrease the angle, and extension of the spine is when you bend backwards and increase the angle. Flexion and extension of the neck are basically the same thing. Flexion is when you bend the neck forwards and decrease the angle, and extension is when you bend the neck backwards and increase the angle. Lateral flexion of the neck is when you move the neck towards the shoulders. Rotation of the neck is when you turn the head to the side. Then there are different terms for flexion of the ankle. Dorsiflexion is when the foot flexes in the direction of the dorsal surface or up to the sky, and plantar flexion is when the foot flexes in the direction of the plantar surface or the toes point towards the ground. Then there are different actions of the scapula. The first one is elevation, which is you raise or move the scapula vertically. Then there's depression, which you lower or move it inferiorly. Then there's inferior rotation, where the scapula is pulled and the glenoid cavity rotates inferiorly. And then there's superior rotation, where the scapula is pulled and the glenoid cavity rotates superiorly. More actions of the scapula include retraction and protraction. Retraction is when the scapula is pulled towards the spine, and protraction is when it's pulled away from the spine. Now, knowing these different muscle movements, we are able to understand how to determine the muscle action. This animation helps us show how you determine the muscle action by representing the muscle as a string. In this instance, we tape the string to the top part of the humerus and to where the clavicle meets the scapula. As seen in the animation, when the end of the string is pulled, the arm moves up to the side. This can be seen as abduction of the shoulder joint. During this movement, the muscle contracts and shortens, which can be represented as how the string shortens and the points of attachment are closer together. Now, understanding how muscle action works, we can determine the muscle action of the different muscles of the rotator cuff. The supraspinatus muscle of the rotator cuff has a medial attachment point at the supraspinous fossa of the scapula and a lateral attachment point at the greater tubercle of the humerus. The muscle striations can be seen to be horizontal in the image on the right, and the action can be determined to be abduction of the shoulder joint. Using the method described earlier, if we pull on the end of the string where the two attachment points of the muscle are connected, then the humerus bone moves upwards to the side. This action we know is abduction of the shoulder joint. The infraspinatus is another muscle of the rotator cuff, and it has a medial attachment point at the infraspinous fossa of the scapula and a lateral attachment point at the greater tubercle of the humerus. The muscle striation's direction is in a diagonal angle, and the action is lateral rotation of the shoulder joint. This animation of the infraspinatus muscle is a posterior view of the scapula and the humerus. You can see once the string is pulled on the end that the humerus bone rotates laterally, which is a rotation away from the midline. The teres minor muscle of the rotator cuff has a medial attachment point at the lateral border of the scapula and a lateral attachment point at the greater tubercle of the humerus. The muscle striations are in a diagonal angle, as was the infraspinatus, and the action is lateral rotation of the shoulder joint. The teres minor has the same action as the infraspinatus, lateral rotation of the shoulder joint. It can be seen again in this animation where the shoulder joint is moved laterally away from the midline. The subscapularis is the last muscle of the rotator cuff. It has a medial attachment point at the subscapular fossa and a lateral attachment point at the lesser tubercle of the humerus. The muscle striations are horizontal with a slight angle, and the action is medial rotation. This animation of the subscapularis muscle action shows an anterior view of the humerus and the scapula. As you pull the end of the string, it shows how the muscle contracts and causes the humerus to medially rotate, which causes the humerus to rotate towards the midline.